There's been so many shifts recently, which are just a continuation of trends that started years ago. And that's really the continued shift towards outpatient care. As everybody knows, costs continue to increase, and there's so much consolidation in healthcare that everyone is looking for efficiencies. And I mean, everyone on the business side or the delivery of care side. So we see a continued shift to the outpatient environment. And that is, hey, if a procedure can be performed outside of a hospital in an ambulatory surgery center, that is desirable both from a quality of care perspective. So it's great for patients. The providers tend to like it more, and then the payers like it as well because it's just a lower cost environment. Yeah, so you're correct that we work on a lot of sale leaseback transactions. And so what we've noticed is that over time, providers don't necessarily have a great exit strategy on their real estate. And so a sale leaseback will provide that. So the historical way of a senior physician kind of getting their money out of their real estate partnership would be for them to sell their shares in the real estate partnership to younger providers. But what we see is more and more of the younger providers, more of the newer generation of doctors, they might be loaded with medical school debt. They maybe just don't want to make the investment, or they're debt averse, at least in terms of taking on new debt. And so that leaves the senior providers who are looking for an exit strategy kind of stuck, right? So they don't necessarily have a way to get their money out of their building because there's nobody to buy their shares. And so we find that sale leaseback transactions provide a solution to that by allowing the real estate partnership to sell the building without interrupting the longevity or operation of the practice. And so this allows the senior physicians to get their money out, but does not disturb the operations of the practice. So a sale leaseback can work really well for that. We tend to see some even more kind of complex situations where, for example, a practice has sold, like the actual operation has sold to a private equity backed MSO or a hospital, and then the physicians continue to own the real estate. And so we work in a lot of situations where it's a lease restructuring where the practice is sold, the doctor's still in the real estate, but they were so focused on the practice transaction that they really didn't pay a lot of attention to their real estate and their lease in particular. And so they continue to own the real estate and collect rent, but eventually they still want some liquidity in that partnership. And so we'll come in and restructure the lease to kind of optimize the asset for sale, which then allows for a liquidity event down the road. So you're right that we do focus a lot on sale leaseback transactions, but there are a lot of other nuanced type of real estate transactions that need some attention as well. Yeah, so one of the biggest challenges with healthcare real estate from an investment perspective is just that it's expensive to duplicate, and so the lead times on new construction projects are really long. Like it can be 12, 18, 24 months, in particular to deliver, a higher acuity building like a surgery center. So that's difficult from the standpoint of bringing new product online, or having new stock that can be leased to providers or health systems, et cetera. So that's a challenge, but at the same time, it's kind of an opportunity because for those investors who own medical outpatient buildings or high acuity medical facilities like a surgery center or a specialty hospital, they're really well positioned because it's not just something that you can duplicate down the road, right? There's a serious lead time that's required. And so that creates some stickiness for their tenancy because it's just hard to relocate. On top of that, we all know that generally speaking, healthcare is a local business. And so from that standpoint, it's usually good for the patients and the providers if the practice doesn't move. And so, you just see that those expensive costs reinforcing that investment thesis, which is that owning healthcare is a stable and steady investment that is difficult to relocate. So as we touched on right at the beginning, outpatient, there's a huge shift to outpatient care. So that is a real opportunity. We also continue to see that investors like and prefer kind of those on-campus or campus adjacent medical buildings. In particular for successful hospitals, there's always going to be providers that are there and providers that want to be nearby. So if you own a building that's adjacent to or on campus, that's really desirable because the doctors who see patients for higher acuity cases in the hospital still need a clinical location right next door. And so if they can be in very close proximity to the hospital, then that makes it a desirable place to operate your practice. So that's really a boon for medical real estate owners, in particular, campus adjacent, on campus, and then obviously the higher acuity centers like a surgery center. That's a real opportunity as well because, as we touched on, the replacement cost and lead time to develop new facilities in that segment is just so long that it creates this kind of captive tenancy. So I would say those are the real opportunities. Great question. So first off, I would say that while there is an incidence of health systems buying certain properties, that's also really a strategic thing. And the same could be said for disposing of properties. So there have been some really big hospital sale leaseback transactions that have occurred, and those have occurred as in an effort to shore up the balance sheet of the health system and create a big liquidity event. But doing so by monetizing non-core assets. And so you're not really going to see, a sale of a general acute care hospital like the actual hospital campus. That is the core asset. It's a strategic asset of a health system. On the flip side, if there's an off-campus medical office building or a surgery center that maybe they're moving away from because they're going to build a new one, they might do, a sale lease back there, maybe just a shorter lease, like a 5 or 7 year lease, in an effort to get the most money out of the building, while still kind of disposing of it from a long-term standpoint and not being tied to it from an ownership perspective, even though they might continue to operate there for some period. And so we see disposition of non-strategic assets or non-core assets. But then to your point, we see acquisition of core assets. So that might be a property that's on campus or adjacent to the campus, or maybe the hospital owns a physician group and they say, well, there's an opportunity to buy the building, and we think that this physician group is always going to be here. So while there might be a big incidence of that occurring, I think it needs to be looked at through the right lens where the focus is on strategic or core assets. Yeah, so we're being focused exclusively on medical real estate. We're very bullish on the healthcare real estate sector. People continue to need healthcare, and I don't see that going away anytime soon. And obviously, there's been a lot of shift and focus on trying to reduce costs, and obviously, telemedicine is part of the care model. But you can't perform procedures via telemedicine, and so that always necessitates some sort of facility in which to perform a procedure or have an in-person visit. So again, we're bullish on medical real estate. We think that it's here for the long term, not just into the end of 26 and 27, and it continues to be a steady investment class in the real estate sector. So you're not seeing 10 or 15% rent growth, you see 2 to 3% rent growth. And so kind of that steady eddy rent growth combined with the long-term necessity of facilities for healthcare, I think creates an attractive investment proposition for a lot of folks.